Welcome to this week's edition of Focus on Connecticut. I'm Tom Appleby. This is our third legislative forum of this year. We do four, all told. We invite our area lawmakers each year to join us on the set and come in and talk about what they see as the key issues in the upcoming legislative session. This year it begins in January, and we have four lawmakers here to talk about those issues. Let me introduce them to you. They are State Senator Kevin Kelly. He's a Republican with the 21st District. That includes Monroe, Seymour, Shelton, and Stratford. State Senator Scott Frantz is also a Republican, 36th District. That's Greenwich, New Canaan, Stamford. State Senator Tony Boucher, what a surprise, Republican, 26th District, and that includes Bethel, New Canaan, Reading, Ridgefield, Weston, Westport, and Wilton. And to balance it all out, we have a Democrat, and that is a State Representative-elect, Kristen McCarthy-Vahey, Democrat, 133rd District, which is Fairfield. Thank you all for coming by. I appreciate it. And
good to be here.
Well, we'll see. We'll be the judge of this after the hour. A lot of challenges coming up in this session, but the big one, at least from the programs we've done so far, is trying to balance this budget. So you have two challenges. You have one, trying to balance the budget right now, because we're somewhere in the range of $100 million in deficit. Governor made some efforts to try to bring that down, but it doesn't look like they've even gone as far as he'd hoped. And then you have, you'll tell me what you think. I've heard anywhere from $1.4 to $1.5 billion that we're facing in the next budget. So what are you going to do about it?
Well, first, since I've been there for the past 4 years, it seems that every January we continue to be in the same position. We keep going back to Hartford and finding out that our government is living beyond its means. And therefore we overspend, and I believe we also overtax our citizens. But yet we're not looking at the fundamental problems. We're not looking at solutions so that we can do more with less. One area that I think we can do better is in the area of human service. In this poor economy and in this state, we have need. I think the United Way has come out with a new ALICE report that demonstrates that there's a lot of working families that are having more and more difficulty making ends meet. So there's a lot of need in our communities, but yet our government continues to go down the same road in the brick and mortar type of social service perspective that's highly costly. So in the era where we have more need, why don't we look at different solutions? One would be to partner with our private nonprofits that are already in place. You have the infrastructure. It would give the state the ability to deliver better services. I mean, we have actually a program review and investigation report that says that they can do a better job quality-wise as well as delivering service at a lower cost. So in an era where we have higher demand and need, and yet we can't afford the government we got, why don't we look at more creative solutions to this? And that's one of the most frustrating parts, is that you bring these creative ideas to the table and we don't have a conversation, we don't have a dialogue, and there's not a bipartisan approach to situations like this, which I think are human issues. They're not political issues. These are our families, our friends, our communities. We should be working on their behalf and making sure that their interests are protected in Hartford.
Do you concur?
I concur 110%. The biggest challenge that we face as a state is our fiscal situation, which we all know is pretty dismal. We continually rank in the bottom 2 to 3 of all the 50 states in terms of our fiscal health, fiscal management, long-term liabilities management. We have roughly $70 to $75 billion in unfunded liabilities that go way out into the future. That includes bonded indebtedness, and if you really look very carefully, it looks like it's closer to $85 billion. So how are we as a state of 3.6 million people going to deal with that going down the road if we can't create a budget that produces a surplus to save our lives? How are we ever going to start funding that? We all know the math works against you if you are officially 42% funded in our state employee pension plan. But it's more like 28% when you look at the real numbers. The math says you can never catch up unless you are about 80% funded, because the market's not going to do it for you. So yes, you're right. We're looking at a deficit this fiscal year of roughly, officially it's still about $65 million, but it's closer to $200 million when all is done and spoken for. And for the next 2 fiscal years, just shy of $3 billion. Kristen, we apologize that you're coming into this. This is baptism by fire. It's going to be a whole entire replay of the last 4 years and even 6 years in terms of dealing with the budget. In Connecticut, we have to start dealing with this because it grows. We're looking at 2 years back-to-back 10% increases. That is inexcusable. The math in the reverse way works against you here. It's just going to destroy, ultimately, the tax base and its ability or willingness to take care of the cost of state government, and at the expense of this problem, or the expense of this problem, is that the social programs really suffer. And Senator Kelly's got some great ideas about outsourcing and doing. We're not going to have any choice in the future if we're going to have those services. Right now, we're looking at Department of Children and Families getting cut back and terrible things happening in that space. I'll leave it to the other two to continue. and you know, there are solutions, and I'm an optimist. We all are up in the legislature. We've got to get down to the business of fixing the state's fiscal house immediately, because we're not going to have a future if we don't.
Well, I'm going to add my voice to the choir here for sure, and I think my very esteemed colleagues have framed the issue exceedingly well. The state is in deep financial trouble. Serving on the Finance Committee, it's the Taxing Committee, we have those serving on appropriations. That's really where the big debate will take place, the spending side and in the taxing side. We are losing businesses, our labor force, and our retirees to other states simply because we have a budget that has never been appropriately dealt with. You cannot have an increase in spending by over $100 million from the previous year and an increase in revenues of $46 million. You can see right there the structural problems and why we're facing deficits. So we know that the state has a serious spending problem because they've taxed to the hilt to try to match it, and it hasn't worked. So where are the solutions? Because in fact, as was just very clearly stated, the people that get hurt the most are the most vulnerable population in our state as a result. Cutbacks to programs that they shouldn't be cutting because, again, spending on things they should not be in the business of doing, for sure. So how do we solve this problem? Well, you really have to go towards the big sacred cows, the protected special interests. You do have to make the changes, whether it's outsourcing of a lot of services to the private nonprofit sector, which is half the structural cost, whether it's technology use in our major agencies that has not been properly updated, upgraded. There's fraud and abuse in the system by the hundreds of millions of dollars, if not even more. And the issues of pensions that was just mentioned, things that other states are routinely doing that Connecticut has prevented themselves from approaching, whether it's contributions to pension plans by state employees going from 2% to maybe 10%, which is a standard. Maybe it is the increase of the retirement age. Whether it's co-pays both on health care and other areas that they currently do not have. There are billions of dollars of savings there so that we can attack the problems that are facing us both in our vulnerable population, but also in transportation, which is the signature issue that the governor has put out, and for us, and my personal priority, which is education funding, the place where we close the income gap. We don't have an income gap in Connecticut, we have an education gap.
I introduced you as state representative-elect. There's still time to get out.
Of course not. I'm very happy to be here, Tom. Thank you for having me, and it's a pleasure to be here with the esteemed senators. And I'm someone who certainly acknowledges the challenges that we have here in Connecticut, and as a municipal leader have understood that at the municipal level. But I'm also someone who looks at the positive side of things too, and I think sometimes we spend a lot of time focusing on what's wrong and maybe not as much time as we should talking about what those actual solutions are. And I think there have been some positives. Certainly there's always room for improvement. That's my philosophy. But you asked us, what are we going to do about the issues related to the budget? And I think for me, as someone coming in new, I'm certainly going to be listening to my constituents, working with my fellow legislators to understand the best ways, the best solutions. I come in with that local experience, that municipal perspective. And I think it's really important that, as Tony was saying earlier, looking at the regional councils of government, looking to our local municipal leaders, hearing from them in terms of what works, because so much of what we do at the state has such a significant impact on that local level. I think there are always creative solutions, and it is important to work together across the aisle. But again, I think it's important to look at the positives that have come. You know, certainly we haven't had this kind of growth that we would like to in our state. And I said here before the election, when I was here with you and my opponent, that we can look at spending cuts and tax increases, but that growing our economy is going to have to be a priority for us in order to be able to come out of this. And there's the immediate short term and then the long term. And I think that working together, again, partnering, working in collaboration with business to be able to do that. And the senator mentioned transportation as an issue, and I talked a lot about that when I was here before and during the campaign, having heard from folks about how critical that transportation infrastructure is to all of us in terms of helping to grow the economy. So I'm very excited that the governor is focusing on that issue, and I think it's certainly something that here in Fairfield County has significant impact on all of us. But I'll be working together with everyone to come up with the best creative solutions we can to make sure that we are helping to deal with the issues of inequality, and I think it is on an income level, education, on all levels, and to make sure that we are protecting those vulnerable populations as well.
You mentioned your municipal experience. The governor, when he ran 4 years ago, said he would not touch the municipalities. There would be no impact on them. One of the ways he balanced the budget, or tried to 4 years ago, was an income tax increase. He said that's not going to happen again. Can the municipalities emerge unscathed this time around?
I don't know how the math is going to work on that one. I have a pretty good imagination, and I'm coming up with Zippo, goose egg. I don't know what they're going to do. Something has to give. Either there's got to be a roughly 8 to 10% cutback in the forecast, the budget forecast on the expense side, or there's going to have to be a new source of revenue to the state. And the campaign pledge was no new taxes, and I hope that's true, because as Kristen correctly pointed out, it's priority number one is growing this economy. We've got the most anemic economic growth and jobs growth in the entire country. There's a reason for that. We used to be number one for a generation, maybe even 2 generations. We were number one. How have we gone to last place? It's because we don't have the right regulatory environment. It's because our taxes are too high, cost of doing business is too high, et cetera, et cetera. So what are we going to do? The thing that concerns me the most is this, is that recently the proceeds from bond issuances have become considered to be revenues to the state of Connecticut. That's a very dangerous territory to be in. Bonding and getting into more debt for the state, one of the worst things that you can do. Yes, interest rates are at their historical lows, and they're not going to stay there for very long, as we know from yesterday's performance in the stock market and a few days prior to that. So there may be a mad rush to do some further bond issuances, but the point is you still have to pay the principal back, and you're on a schedule. Can Connecticut handle that as our debt as a percentage of the overall budget goes from 12 to 13, 14, 15% as interest rates start going back up? That's an extraordinary large percentage, and my argument has been all along is that that's when you really start to put yourself at the in the category of being insolvent, and eventually the rating agencies will catch up with that, and eventually the markets will say no more.
Well, they already give
Just,
Connecticut a
I want to
negative.
clarify, we're taping this a week in advance, so when you say yesterday's report, I don't want people to think, what world is he operating in? Because it did happen. Okay, I'm sorry.
last week's.
Not at all. I think the rating agencies already know what's happening. This is why they give us a negative outlook. And all you have to do as administration is take a look at that report. They will tell you exactly what you're doing wrong and what you should be doing to fix it. There is no question. We have a spending problem. That's why we're in this predicament. And as you said, is it going to affect our communities? Of course it is. Even if it's just the residents within that community that have to also bear the burden of the local property tax increases and costs for their local governments. There is no question that everyone will be affected. You cannot spend 16% over the 4 years of the worst economic downturn we've had and expect things to turn around for you. Other states have put a halt on that kind of spending. And by the way, spending for the wrong things, and in the process of trying to close that budget gap, doing all of the wrong financial strategies, such as borrowing from future possible revenue sources, because sooner or later, it's going to come to a screeching halt. That's where we are. The question is, how do you solve it now? And that's the area that has to have very close scrutiny and where this administration has to go. They're going to be proposing another 2-year budget coming along on the heels of still a structural deficit. So, you know, we shouldn't be there right now, given the high tax increases that were put in place. Most of us on this dais right here voted against that tax increase and proposed really good, positive alternatives that were not seriously considered. Now I think they have to seriously consider it, and as just stated before, there are many strategies that can save us billions of dollars. Tampering just a little bit with health care plans that are currently in place, that are the platinum plans for our state employees, just tampering a bit in the past have produced $700 million worth of savings, both in the Rell administration and now in the Malloy administration. So there's more billions of dollars of savings there. We have to do that to prevent further tax increases. If anything, if you decrease certain taxes, you actually increase revenues, because when people flee, you don't get that money. You don't get it in the door. Giving businesses a new plan like New York has by excusing any taxes for a 10-year period if you create a new business and new jobs, well, that's not a loss if we did that in Connecticut, even if you did it for 5 years, because that's business that you wouldn't have before. It's not tax revenues you lost. You never had them in the first place. So all you can do is gain. Again, I think you should be looking at spending decreases and tax relief that will keep residents here and grow businesses here.
Well, Tom, you asked if the municipal governments would remain unscathed, and I don't know the answer to that. Obviously, I'm coming into the session and will be in conversation, but I think that the cuts in other states to local municipalities haven't worked out as well, and I think it's important that we work to protect that, because it certainly does have a tremendous impact on those local governments, on property taxes, and folks really bear that burden. So yes, there are a lot of challenges to be faced, but I certainly, again, coming from that experience, I know firsthand what it means to the local budgets and to the municipalities to be able to provide the services that we as a state count on them providing, and education obviously being at the top of that list. Certainly most places are spending a fair bit, or if not a majority, of their budgets on education. And I think that is a really significant issue that we, as Tony said earlier, that inequality there, we need to address that. That is a way that we are going to move forward in the future. And some of the investments in education, not necessarily at the municipal level, but certainly with our technical community colleges, the ability to have a trained workforce who are here ready to work in the industries that we're creating here and that we are supporting and incentivizing. We need to make sure that we are providing the proper funding for those programs. So I don't know. As Scott said, we'll see.
Focusing on that point of the costs on municipalities, when you look at the relationship, theoretically, of the state to the towns, it's much like a parent-child relationship. The state tells the municipalities what they can and can't do. And one of the problems that I see in Hartford is that many times the state puts a lot of what it wants, its wants and desires, on its towns.
You're talking about mandates.
Unfunded mandates, particularly. And that is a heavy burden that's not only placed on our towns, but then once again on our taxpayers. And a lot of times when we look at bills, the structural way that we do this, we get the report from OFA. It'll tell us what the state's going to spend on a certain thing, but it doesn't tell you what other people are going to pay on. And that fosters this kind of unfunded mandate. And we have to start looking at these things, as looking at the regulations and the mandates that we're putting on our children, town, municipal governments, and recognize that that's a burden on our taxpayers. And when we look at the way that families are trying to deal with their future, I like to call it kitchen table economics. How does mom and dad deal with the family budget? And why can't, if we're all moms and dads and people that have kitchen table economies, take those same economies to the state and engage in the same practices? To find that during the campaign running up as early or as late as October, the governor's telling us that the economic picture is great. that we're not in a deficit, and then to find out a couple of days after the election that we are in deficit. Okay, putting aside the election, that's not fair to our families. To say a month ago that now, after you've having trouble balancing your budget, that the state's failure to balance its is going to possibly do one of two things to you. Either increase your tax burden, if we keep the government the size and scope that it is, or reduce services that people depend on, and particularly the people that are on our fringe and are vulnerable. And I don't think as a government we should be engaged in that type of activity. We should be a little bit more proactive, we should be a little bit more transparent, a little bit more honest. And so when we want to tell the municipalities to act in a certain way, we should put the dollars behind that, because that's our want. And if it's our want, then we should have also the political courage to fund that want. If we can't fund the want, then maybe what we need to do is evaluate all the mandates and say, before we add a new mandate, let's evaluate, maybe there's one that we put in 20 years ago that's no longer valuable, and we don't have to keep that burden on the municipality. So that as we add burdens, maybe we can take burdens away to keep them cost neutral to the local governments. I think we have to start to partner with them and get a better dialogue, because I think a lot of times what we do is we talk past both people and organizations rather than talk with them.
Can I give you a stark example? Our 18 governments came together this morning. With
regional.
Regional. It was the Western Council of Governments, 18 communities from Greenwich to Westport up to Danbury and beyond. One of the things on their plate, the municipalities said, was one mandate relief, which is prevailing wage, could dramatically reduce the cost to local municipalities without having to even talk about, a bill that has to do with funding or money, and that is prevailing wage. The prevailing wage was mandated by Hartford to municipalities that they have to pay a higher wage for any municipal project, a school building, a police station, and I'll tell you how this translates. That someone putting in flooring in one of those buildings that typically would charge $10 an hour for that project has to, and this just happened this year, has to charge $55 an hour. $55 an hour for that same job. Think of the cost savings to municipalities if they were just allowed the freedom to charge normal market rate for that particular job.
Let me switch gears here. This is a long session. The legislature has short sessions every other year and long sessions. And the long one is the one in which you formulate the budget for the next 2 years and look at other issues that you think need to be addressed. The short session is supposed to be tweaking the budget, but of course you also look at issues. So this is the one where you get a wish list. What's on your wish list? What would you like to see happen aside from the budget and all of its constraints?
I have 3 kids at home, and we celebrate Christmas in our house, and I think the list is long, and certainly there are many, but I think there are a couple things that are priorities, and I'm going to come back again to transportation, that we really look at our long-term plan for transportation, that we look at effective funding for that we continue to be serious about what we're doing for that we look at transportation in a way that doesn't just consider the single occupancy vehicle, but considers mass transit. Certainly here we have Metro North, that we consider pedestrians, bicyclists. That's huge. As we come up on the anniversary of Newtown, that we continue to focus efforts on mental health prevention and wellness. And those areas we talk about our vulnerable population, that we continue to improve efforts there, that we look at gaps in services for folks, and with education, that we continue the conversation. There were a lot of conversations that were had in the last session related to the Common Core and teacher evaluations, and that we continue to address some of the struggles that have happened with that and look at the impact going forward, whether it's testing with the teacher evaluation or the implementation of Common Core. Those are some of the things that are priorities for me.
Well, I know that the transportation component is on the governor's wish list, because he's already talked about that in the last couple of weeks, saying he wants to see some major projects undertaken. How do we do that? Given what we just talked about for the last 20 minutes, how do we spend, it's going to be billions by the time we're done.
Well, we have the ranking member of the Transportation Committee to your left, and she will have a lot to say about this. But I think the most important thing that the administration can do, and certainly the General Assembly, is prioritize. You've got bridges, railroad bridges, that are well over 120 years old. We've seen failures. We know that some are literally operating only because of manual assistance each time that they either turn or go up and down. And we're going to witness the opening of one of the great boondoggles of Connecticut's history in transportation, and that's the busway from New Britain to Hartford, which all the polls and surveys have discovered that not many people are going to ride this thing, and it cost well over $600 million. And yes, most of that came from the federal account, but it still did cost us $140 million at the end of the day. That's a project we probably should not have built. We should have taken those funds and talked the federal sources into allowing us to use that for other projects, such as our decaying railroad infrastructure and our bridge infrastructure on the highways. We've got 400 structurally deficient bridges. We've got thousands of others that are not too far behind. I would defer to the ranking member of the Transportation Committee, who studies this very, very closely.
Well, Tom, you asked what our wish list is. I would love to subscribe to the Hanukkah approach of the 8 different nights and have a lot more room in there, because we have the issue of jobs and creating a fertile environment for them to grow and a less taxing environment for residents to stay. We have educational issues, which are a huge priority of mine as well, of giving more flexibility to local districts, relieve them a lot of the huge, costly, and difficult mandates that have been provided. And then we have transportation, and that's been a huge focus for all of us on this panel with you today. We all have these same strong priorities because Fairfield County has huge needs. We sometimes get divert funds to other parts of the state when most of our transportation needs are in this congested, huge corridor where a great deal of our ridership on rails is concentrated. And so all of our economies, and I would maintain this issue is a Boston, New York, Philadelphia, Washington, D.C. issue. So when we talk about this and how we affect this, we should be talking about how it affects the entire regional economy, because what stalls in Connecticut affects all of these other states and its economic survival and health. So as was just mentioned, we have huge priorities and needs, notwithstanding the 400-year-old bridges that need to be fixed and upgraded, not to mention the catenaries that often break down that stops the trains. We have branch lines that need desperate upgrading and improvement. We need time and safety issues to be addressed. Otherwise, we lose population that have relocated to Connecticut, and they'll move back because they need to get to their jobs on time. So those are huge, huge issues that need to be addressed, along with short-term needs and long-term planning needs, where we can actually think about how we change the dynamics on 95. Can there be another mode of transportation instead of the busway to nowhere? Could there be a monorail system that would be elevated along that corridor? Do we expand the exits and exit ramps there? How do we deal with 84? There's a bottleneck up at 84 between exits 25 and 28. That must be addressed. A third lane needs to go there. So why? How do we pay for all of this? And I can guarantee you, this new initiative to focus on transportation will probably involve some people proposing the return of tolls. And that's going to be a huge debate, because we have the highest gas tax in the country. And by the way, the announcement of toll increases have just been announced last week throughout the tri-state area. So, you know, there's another taxing opportunity. But stop, hold your horses, okay? The bottom line is Connecticut has been diverting transportation funds to solve budget shortfalls. It shouldn't be doing that. It's spending money on projects that don't have the same benefit and return on investment than these others do. We need to reprioritize where the funds are and where we get cost savings and reintroduce them to our rail transportation issues. Because when you talk to small business, I met with 2 last week, I thought, oh, business taxes would be, payroll taxes would be right at the top of their list. Yes, they were concerned. The second thing out of their mouth, transportation.
I mean, as we look at this, and you know, we've talked about prioritizing. You know, let's keep in mind that the state budget is well over $40 billion. 40 billion, 44. So there's a lot of money around. You know, the second thing Senator Boucher talked about was the highest gas tax we pay is for special transportation. That's for road safety, so that as we travel on our roads and our transportation, it's safe. And yet, that fund isn't in a lockbox. It gets poached every year and put into the general fund and diverted away from transportation issues. Then you look at the investments that the governor is making in transportation. Senator Frantz talked about the $600 billion that we spent, and whether it's from Hartford or Washington, it still comes from our pockets. But that's $600 billion, or million dollars of investment in a 9-mile stretch from New Britain to Hartford. Okay? You also have additions to Metro North, which we're building the Fairfield Metro station. You have a new station in West Haven. You have improvements to Stamford. You have a new line proposed, a new stop proposed in Bridgeport. So we're adding capacity to something that presently we can't maintain. I mean, that's like buying a new car when your other car isn't working, and you need 2 cars. I mean, why don't we fix what we can have? So you look at this, and then getting back to the busway, the problem with the busway is that when we do make our investments, not only was that an expensive investment for a 9-mile stretch. You know, I'll tell you, coming down here to Norwalk today at 9 a.m. in the morning took me over an hour from Stratford. If I came at, I'm going to say in the evening or on the weekend, it would be half that. Okay? Why aren't we fixing this? Well, it's looking at things like what we're doing with the busway. 9 miles of stretch between New Britain and Hartford didn't only invest in that, but it also took away an opportunity. And this is what, representing the lower Naugatuck Valley, I'm concerned about is looking at that busway went in on the commuter rail from Waterbury to Hartford. So now that commuter rail is no longer going to exist. It goes over the same 9-mile stretch. So the riders from New Britain to Hartford could still have gotten on mass transit, but somebody coming from Waterbury to Hartford can't. The second thing is the capacity on the Waterbury line that runs from Bridgeport to Waterbury. So we don't have sufficient capacity so people don't ride that on a daily basis because it's one track going up and down the Waterbury line. We need siding. We need improvements. We could have taken the money, reinstituted the commuter rail line, helped increase capacity on the Waterbury line for less than it costs to do the busway. What that does is some of the most chronically unemployed individuals, people that live in Derby, Ansonia, Naugatuck, Beacon Falls, they don't have now the opportunity to travel through mass transit to Hartford. That forecloses economic opportunity to people that are looking for work. And I just think that when we make our investments, I think government has the rightful place to make investments in things like transportation, because we know the hour it took was loss of productivity, loss of time with our families. These are the important things to the people of Connecticut. But we have to be more prudent. We have to be smarter to look at this and say, is there a better solution that's less costly to the taxpayers and has more economic benefit? I think we could have done that with the $600 million that went into the busway, but we chose not to. And I think going forward, as we look at the wish list, I think we have to start looking at these opportunities to increase siding, increase capacity on the line so that people don't have to be behind the wheel of a car for hours on end on 95.
Working my way down your wish list, both of you talked about education early on. Efforts were made in the last 4 years to work on education, and they were not successful. We're back to revisiting, rethinking the whole thing. How do we take on this enormous challenge?
It's huge, Tom. It really is. And that's why I'm going back as ranking member of education as well as transportation. Those are two of my big priorities. And it's why I first even got involved in public service. I was on the local board of education for some years, on the state board of education, and choosing commissioners back in the day. Back in the Ted Sergi days, and now on the Education Committee. And I can tell you that with all good intentions on the part of the administration, I have to say that, they really tripped up right from the get-go by basically framing the issue of change and reform by really attacking teachers. And that set a terribly negative tone. It's the opposite. These are the people on the front lines of our educational system. They are to be respected and be a part of the process of change because they know what works and doesn't in a classroom. So the whole notion of throwing everything out there all at once, first, changing the evaluation system for teachers in a classroom, which some districts were doing very well and had negotiated well with their unions, but yet other districts were faltering. This is the problem of painting everything with a wide brush instead of taking a very specific approach to districts that are really having trouble, the ones that need help, the ones that maybe need more oversight. Yes, but not throwing everything across the board and actually tampering with what is working. And that, by the way, and Senator Kelly is one of our great experts in the area of healthcare, and we talk about this a lot. I think it's the same negative approach. It's you take a look at a problem and you change everything wholesale, even the parts of it that's working. I would maintain that you leave what's working alone, including healthcare, and just fix the part that you think is broken and have greater oversight. So the issue of changing teacher evaluation, okay, that's one thing. Then Common Core instituted across the districts. Then a new evaluation system based on that all in 1 year or two. It was absolutely over the top. It was impossible for people to really assimilate, to deal with. It should have been phased in if they truly believed a new system was in order. And it should have been phased in probably in districts that were most failing. And it should have been done at the lower grades. And it could have taken 10 years to be able to do it. But no, instead they wanted to do it all at once. And people literally were so distressed and distraught. And it put so much pressure on the school system, the administration had difficulty assimilating it. Students were failing on tests that they were given on material they never even saw before. And teachers as well were being evaluated on curriculum and tests that no one saw before. So it was really destined for failure. Now they've backtracked and they're pulling back. We have now an opening for a new commissioner. No one really knows quite what will happen, rather than allowing the local districts to pick and choose their method of curriculum and also the tests they need, with the exception of maybe the failing school systems, the Alliance and Network schools, and maybe making those rules apply to them first. So I think we have a lot on our plate in education going forward. I think we'll have a lot of new ideas and proposals and new leadership at the top. Very interested in what that new leadership will propose. Hopefully there are people that really are knowledgeable about what's going on in our school systems, not just in the failing systems, but the ones that are working well, and make them a part of the process. I know I am meeting with them and analyzing some of their recommendations right now.
I expect you heard a lot of negative comment when you got to the homes of educators as you were out and about on the hustings.
Well, I actually did speak with a lot of teachers. In Fairfield, in the 133rd, there are a lot of teachers who live in the district who teach in many different communities, from Greenwich to Newtown to Westport to Fairfield itself, Bridgeport and beyond. And I did hear a lot from teachers who had a variety of strong opinions. I'm someone who believes that those who are impacted by a decision should certainly be included in the conversation. And I think, with education, we go back to first and foremost, this is about our students. This is about making sure that we're creating the best learning environment for them, that we're creating the most opportunity for them to succeed, for them to perform, for them to reach their highest potential. And that we look to our teachers first and foremost to do that they are the people who are in the classroom every day with the students making that happen. In terms of some of the initiatives that have come, I think it's great to have high standards. It's great to have clear expectations, and it's understandable that we want to look at across the board. We want to make sure that all of our students, especially here in Connecticut where we have this achievement gap, are able to perform at certain levels. That's a wonderful thing. I guess the devil's always in the details. And when we have a new test that's combined with a new curriculum, and a test that requires us to provide technology in the classroom. That was a real concern, even in Fairfield, and certainly there are other districts who struggle more. Having technology available in the schools, providing the funding for that technology, and that impacts the municipal governments. Providing the training to students, some of whom may not have the kind of interface with technology. And transitioning into that, and then asking our teachers to be evaluated based on all of that, given that it's a new system, I think it was a lot, and I did hear that certainly from the teachers. On the flip side, I heard positives. Again, I will acknowledge those struggles, but some of the positives were that when we look at curriculum changes, and some of those related to the Common Core, that we're asking our students for a higher level of discourse. We're asking them to engage in a different level of critical thinking. Certainly, as Senator Boucher said, there are some districts that have already been working on those things and are there, and others that are getting there. We were recently at a forum with superintendents and Board of Education chairs, and there was a comment about teaching math. You know, someone said something about, it's hard to be able to teach math now to my children because it's so complicated. But it is different. We're not asking kids now to just memorize and spit facts back out. We're asking them to really think critically in a whole different way. So we do need to continue to push ahead in looking at improvements and looking at reforms. It's just we need to make sure that we're doing that, including the right voices at the table and hearing from the teachers. And frankly, I have a teenage daughter who says we should be hearing from the students as well.
How about these voices?
You know, we've known for many years now that Connecticut has the lowest ranking in terms of the achievement gap in education. And when the education bill went through, we thought that that was going to be an outstanding opportunity to address that very issue. And there was a lot of support coming in from the private sector, a lot of volunteers willing to address this problem of the achievement gap head on. And unfortunately, Common Core became the focal point of this. It was the execution plan or the implementation plan was ill-conceived, and it was basically ramming it down the throats of educators, teachers in particular, and that was the wrong thing to do. And as a result of that, we have set ourselves back probably 2 to 3 years, both in terms of being able to implement a system that does have some merits. There's no question we do need higher standards and higher levels of discourse, as you correctly pointed out before, amongst our students in order to address things like the achievement gap, but to keep the overall averages going up across the state regardless. And so I consider that to be a lost opportunity of at least 3 years, maybe even 4 or 5 years. We're going to go through this transition again where we have to find a new commissioner, and that always takes time, and it takes time to get used to the new post and all that, and then we have to start working with that new commissioner. So it's a shame because it's one of those things that we used to be ranked very highly in, was education, particularly higher education, right here in the state of Connecticut. The Knowledge Corridor and all these wonderful secondary schools and high schools that always did well nationally. And here we are looking at kind of another morass that we're going to have to deal with, and it's going to take several years, which is unfortunate. But we will deal with it.
I agree. Teachers are the professionals that we entrust our children's education and thereby entrust our future. They're the ones that are going to educate the kids. And so, as such, when the education reform came out, there should have been a better and more robust collaboration with the professionals in the field, in the classroom, that are dealing with our kids to have an impact and conversation on what that policy is going to be. We can see and recognize the problems that we have in Connecticut. The achievement gap is one. And education are the keys out of poverty. That's the piece of the American dream that every kid is entitled to and should get the best education. And when our children aren't getting that, we need to do something about it. On the other hand, there are things we're doing exceptionally well, and our educational system is one of the best in the country. So what we have to do is look at our problems to see what we can do to fix those. But at the same time, when we make the investment in education and we produce great products, we also have to look beyond education and say, what are we going to do to help keep those kids in that investment here in Connecticut? How do we make that investment worthwhile to the taxpayers so that we can have the better economy, the better communities, the better transportation system? It all comes out of education, because if you have a better educated society, you have a better economy, you have a better electorate, which is all just better for our community. And And so we have to look at how we can have the collaborative effort with teachers to reform and improve our educational system. But we also have to look beyond the educational system and look at that as saying, well, what's the impact of a good educational system to our economy and our communities? And also focus on ways to put these kids to work when they have the education, and that they don't have to go to Chicago or Dallas or San Francisco. They can stay right here in the community where they were raised, where they want to live and raise their families.
Tom, may I add something? I think Senator Scott Frantz really hit it well on the head when he talked about the structural issues with Common Core and the way it's been rolled out and the problems that we have there. But also, you know, he's ranking member of Revenue, Finance, and Bonding, a committee I also serve on because, you know, the tax policy of the state and the economic discussion we started this whole afternoon on was very important to what is happening in education. You're absolutely right. We were #1 in the country back in 2000 in 4th, 6th, and 8th grade scores nationally. #1. It was huge, something to be proud of. We have fallen back quite a bit. But those economic policies and those budgets and those tax issues we've discussed have had an impact on the demographics of our state. It has changed dramatically. You'll see it in all of our communities as well. The demographics are that we have a poorer population, more children on free and reduced lunch in the classroom. They have greater needs than ever before. It will impact our scores and our achievement gap by a lot and what we have to do to deal with them as a result. So this is important. But I also want to add, on a very positive note, we're still the greatest country on earth for education, because although we may be at the middle of that pack, you know, we're the country that really believes in educating everyone from every economic level. And even in free democracies, oftentimes different segments of the population at different economic stratas can't access education. So you have them educating sometimes a more elite group of students that we compare ourselves to. And it's true that technology, we can do so much better, and we need to, instead of being left behind. But we also try to educate the whole child as well. So I wouldn't downplay the great, great advantages and the great system of education that this country has.
And Tom, just to build on something that Senator Boucher has said, you know, when we look at educating the whole child, we also have to make sure that we are addressing those students' basic needs, and to make sure that our kids are healthy. I touched on the mental health, but I know that we've looked at the school-based health, and that is something that's a very successful effort in terms of being able to help children be able to learn in the classroom. So we need to make sure that they're ready. They're coming to school ready to learn, that they're not hungry. Obviously, again, those basic needs, and I think that's something that's a part of that whole equation as well, and needs to be protected.
You mentioned health. We undertook a major challenge with our attempt at dealing with the national health, Obamacare, and many felt it was successful. Is that what you heard as you talked to your would-be constituents?
Well, I had a primary this summer, and so I was out talking to the Democratic voters, and then again in the fall to a broader population. And I certainly heard from a lot of people who had benefited tremendously from having the opportunity to sign up for health care when they maybe hadn't had it before, to have it be more affordable. And I talked to some families who it didn't work as well for, and who have asked that we look at how changes be made. It's with any new initiative. You certainly put something forward, and then as you get into it, you realize that there are improvements that can be made. And I think one of the areas that we are impacted by in Fairfield is that there are some families who ended up being perhaps struggling more as a result. So I think that there are some issues that need to be addressed, but overall, the feedback that I got from people was, wow, what a tremendous relief that I am able to have health care and not have to worry about a pre-existing condition, that I have, you know, young people who may right now in this economy be struggling to find a job with benefits, who can stay on my insurance at this point. So I definitely did get positive feedback, but there were certainly some who recognized that we're going to need to make some changes.
Yeah, and
an expert right there.
One of the things, I think it's still too early. I'm ranking on insurance. At this point, it's still a little premature to decide whether or not Connecticut has been a success. On one hand, we went out and enrolled a lot of people. And when you do go out on the campaigns and coming off it, you talk with people. Everybody wants quality health care that's accessible and affordable. Everybody wants that. And I don't think anybody disagrees with that concept. But when we look at the way that the affordable health care was rolled out in Connecticut, the focus was just on enrolling individuals. If you get more people into the pool, that in and of itself is going to reduce costs and do all these things. And the fact is that in Connecticut, and we had Kevin Coonahan, who was the executive director of Access Health, who's now gone on to national. And even when he was questioned on did they make sure that they had the right mix in the pool of age and tiers on the metal categories, he said no, the focus was just enrolling people. And here, once again, we miss an opportunity. Connecticut is the insurance capital of the world. We have insurance actuaries basically on every corner in Hartford. We have more talent in this area than anywhere in the world. And the fact that we didn't set our exchange up to succeed and rely on what he called the federal risk corridors, federal insurance, is basically relying, if there's adverse selection into the pool and if it doesn't sustain itself, we're relying on federal tax dollars. What that means is that while the federal tax is coming in, the tax money's coming in, what's going to happen when that dries up in a year or two? That's a burden that's going to be saddled with the Connecticut taxpayer unless something is done to make sure that the exchange is viable and sustainable on its own, actuarially. We haven't done that in Connecticut. And so we can talk all about how it was great enrolling people and you see the balloons and the storefront openings across the state. But the fact is, we're going to find out when the rubber meets the road in a couple of years whether the Connecticut taxpayer is going to be saddled with that cost or not. And if they are, then we'll see whether or not this was a worthwhile endeavor.
Are you optimistic about this?
Me? I am an optimist, but I am not optimistic about this program, meaning Obamacare. And the reason is more based on anecdotal evidence over the last, call it about a year to a year and a half or so, in looking at insurance, health insurance premiums, in talking to a lot of constituents who are scared to death about what's going on. Their premiums have gone up in, say, the last 3 or 4 years by probably 50 to 60%, in some cases over 100%. Now that you have Obamacare essentially almost fully implemented, 80% implemented at this point, taking care of previous conditions, taking care of kids who are up to 26 years old, et cetera, the cost structure, it has to, by definition, essentially explode. So that's one end of the equation. The other is that the insurance companies are now saying, okay, we're charging you more for your insurance premiums, but we're also going to give you dramatically higher deductibles. In many cases, I'd say in most cases, for a family of 4 or 5, the deductibles went from roughly $2,600 on average to as much as $20,000. Now, if you don't have a very lucky year, just add that as another out-of-pocket expense to your premiums, which are typically for a family of 4 or 5, about $20,000. That's a lot of money. If the median income in the state of Connecticut is $68,000, call it $70,000, after-tax dollars, because at the state level you do not get any deductions, itemized deductions, for health, education, charitable, et cetera, it becomes well over 50% of your pre-tax take-home pay. After-tax, God only knows how much it is, but that can wipe out families left and right. So it's that portion of the larger part of the population, including the middle class, that I think is very much at risk of this thing completely backfiring.
Well, I must tell you, the Obamacare issue is one of the major reasons that there's been a complete change in the political landscape in this country. It is that big of an issue. It's huge. It's huge. And what certainly Scott Frantz just talked about, out of 10 people that called me, and I received a ton of calls about this, out of 10 people, 2 were positive because they were able to either access or have lower premiums, based on the 8 that were upset, furious, because the cost shift went to them. The reduction in their benefits and their huge precipitous climb in their premiums was a way to offset the cost of providing health care for the others. So basically, you've taken a plan, and by the way, all of those people that signed up, a lot of it was just shifting a lot of individuals from Medicaid over to this plan. It wasn't really new people signing up. And by the way, a lot of the young people are still not signing up for it. And some good things happen. Excellent. Pre-existing conditions. 26-year-olds are still covered under our plans. Everyone supported that. But the notion and the falsehood that people feel perpetrated on them is that you're going to have affordable, accessible, and quality. Quality and accessible is not affordable. It's going to cost somebody more. And there were all kinds of taxes embedded in this. That 3.8% increased taxes on any unrealized income, on houses, on investments, so forth, that is felt by everyone, not including this huge climb in premiums. And by the way, their loss of their doctors, the loss of senior citizens of their doctors, mid-care of conditions that they had. So I'm going back to what I believe, both in education and mandating reform and in healthcare, is that you leave what's working alone. 92% of Connecticut was covered under healthcare, a plan privately. That's the highest percentage covered in the country. 8% were not. It would have been less costly, less disruptive if the state of Connecticut and all of us citizens as taxpayers bought those 8%, a private healthcare plan that was a good quality plan, and we would have 100% coverage because it would have cost us less and not disrupted the process that was working well.
And don't take your eye off the ball that we also, while we rolled out the Affordable Care Act, placed a tax on hospitals. And as we push more individuals away from private insurance products towards Medicaid and Medicare, and Connecticut is an aging state anyway, but as you have more people in those insurance products, so to speak, they pay less for the same service than a private insurance. So you're seeing less and less people with private insurance, which means it's more and more costs on hospitals that the state actually adds another tax to. So when we start talking about accessible healthcare institutions, well, that's also your local and regional hospitals, which now are struggling. So your Griffin and Derby and your Norwalk, your smaller hospitals are now being threatened, and that also reduces access. So we got to look at this more holistically.
We're being threatened by the clock. We've run out of time. I thank you all for coming by and giving us some sense of what we can expect in this coming session. I wish you the best of luck. Sounds like we're going to need it. Thank you for joining us as well. Happy holidays. Stay tuned. The news continues.